I graduated James Madison High School, public high school in Brooklyn, and I went to Syracuse University, so I am an Orange man. I'm very involved in the life of students at the school. And I'm a member of Zeta Beta Tau fraternity. And my education went on to medical school. I finished up at Mount Sinai School of Medicine and trained in Cornell and Columbia. Morristown Medical Center was where I had most of my surgical training under the auspices of Columbia University at that time. And trained in Cornell at Sloan Kettering Memorial at one point, where I had extensive experience in reconstructive surgery from the head to the toe and a lot of breast reconstruction. I was involved in the first tissue expander reconstructions at Sloan Kettering and also at Morristown Medical Center, and have had extensive experience teaching anatomy of the hand and of the face at University of Pittsburgh and at meetings of plastic surgeons in New Jersey and New York. I am an expert in rhinoplasty, nose jobs, eyelids, facelift, breast augmentation, breast lift, tummy tuck, and liposculpture, as well as non-surgical techniques of Botox and fillers. One of the things I was most excited about was when I was invited to an international meeting to talk about my technique in plastic surgical technique of facelift, the Z-lift technique of facelifting, as well as the Society of Aesthetic Plastic Surgery. At a national meeting, I spoke on the same technique. I have taught anatomy of the face to other plastic surgeons, young plastic surgeons, and it's something that I cherish in my ability to teach other doctors and other residents on how to utilize the best techniques for getting the best possible results. I have extensive experience with breast augmentation as one of the focuses of my practice. I've done well over 1,000 procedures in breast augmentation. I've have experience with silicone and saline implants for over 35 years. And proportional breast augmentation is basically what I most often want to achieve for someone. I'm also very acquainted with non-surgical techniques, such as Botox and fillers. I seized on Botox when I was first introduced and took several courses on how to utilize Botox when it first came out. And after several years, I actually gave a talk to my fellow plastic surgeons in New York on how to utilize Botox. And I continue to seize or embrace new techniques of Botox utilization, as well as different neurotoxins that are available. One of the things that's important to me when a patient comes to see me is understanding what their motivations are, what they're concerned about. And once they've identified what they're concerned about, then I can discuss whether I can help them or not. Once I've identified those things, I will go into depth about what techniques would be best utilized to correct those things, and what other things might be considered, and whether in fact surgery would be beneficial to them or not. I love meeting friends and families of patients who are satisfied with their results, because for me, for someone to be satisfied is what I want to achieve and what is most important to me.